right now? Well, let's talk to Dr. Bharat Pankania. He's a senior clinical lecturer at the University of Exeter Medical School and joins us now. Good morning to you, Bharat.
Good morning.
Thank you
Good
very
morning.
much indeed for joining us. What do you make of this report? It's pretty damning. Not many surprises in it, I think we can safely say, after the hearings that we saw often televised for the general public to watch as well. But what do you make of their damning criticisms of the government's handling of the pandemic in the early weeks and months?
It's extremely upsetting. I was reading the executive summary late last night, and I felt we were telling you about all these things. And as you correctly identify, the word that was coming all the time in my mind was Jeremy Hunt. You were the Secretary of State for Health and Social Care, and under your aegis, exercise Cygnus, exercise Winter Willow were undertaken. Recommendations were made. Recommendations were not implemented. The pandemic arrived and we suffered. So there is a lot of, we need to look at, why didn't you do what you were told to do?
Yeah.
It really is upsetting.
And this is the thing, we're told, we need to plan better for these things. Well, we did plan. There was plenty of planning. There was ordering of PPE. There was there were plans for how you would prevent infection spreading and what you would do. But we just ignored a lot of it. Very little of it was acted on. We know that the Public Health England was burning excess PPE in January, February, when we knew that reports were coming out of China that there was this pandemic and there were fears that it would spread. We know also that the countries that did very well early on were a lot of the Southeast Asian countries, which had learnt from SARS to have a test and trace system in place. And they obviously had better stocks of PPE, they exercised social distancing early on. Do you think that we should actually learn a lot of the lessons that they learnt early on?
Of course, not only that, but we should have copied. We were too jingoistic that only we know how to do this better. And having worked in CDC, United States, I can sense that jingoistic thing of we know better. And CDC was similar in their approach, only we know the best. Now, with respect to test and trace, we spent £35 billion. That is a lot of money. That is the entire public health and primary care budget on test and trace. When people like myself were saying, enable local Public Health England to lead on this, to set up the test and trace and testing, and that becomes a national asset rather than engage a private commercial firm to set up from scratch a test and trace system, which was never going to work properly. And we spent so much money doing it.
And we did learn early on, didn't we, that actually when it was local public health officials who were getting in touch with people, that, going around knocking on doors, they were actually able to track far more people. I mean, way more people than someone who'd just been trained up for 10 minutes and told, here's a list of numbers to call. And if no one answers, move on to the next person. I mean, this was really basic stuff, but people being paid a fortune to run a system that didn't work. But again, this was all in the pandemic advice. Now, okay, we had a different pandemic from the one we'd planned for. We planned for a flu pandemic, but actually remarkably similar in terms of how these diseases spread and certainly the risk level now after vaccines. And obviously at higher risk certainly for elderly people, far higher than flu in the early stages. But why wasn't it acted on? Was it that it was too expensive? Was it that there wasn't any focus? We'd had a number of changes of government since we'd had reports into this. Was there any good excuse for this not to have been done? Because even if the politicians took their eye off the ball, which they clearly did, I would still expect that the reason why we have a civil service that is there all the time, and Public Health England would be part of that civil service and NHS, to say, no, Minister, I know you don't think it's important, but you need to do this because this is vital planning.
Julia, you're hitting the nail on the head, spot on. So the exercises were indicating that you need to do the following, and I know the PPE, the visors, the expensive stuff that you need, the good quality masks were not purchased because it was felt it may never happen. We don't want to invest. Then our leaders in Public Health England, etc., are part of the civil service. And it is very difficult for them to stand up and say, Minister, you are wrong. You need to do this. So we have Public Health England, which the public think is an independent organization looking after the interests of the public. Yet its own chief executive officer was hardly ever seen during the pandemic. We hardly ever saw him at all. And it is people who are already in the civil service working with ministers find it difficult to say to them, you're wrong, you need to change tack.
What would you do differently if you had been in charge? What would you have done, given where we were at the point at which the pandemic hit this country? Although lots of evidence, actually, it was in the UK, November, December 2019. Some say even sooner than that. But if, at the point where, say around February last year, when we knew it was coming, what would you have done differently? That was viable at that point, given where we were in terms of planning and supplies.
It's very straightforward, Julia, which is we do what our plans have always said we do. We act early, we act fast, we act extensively. So when people have said to me, this lockdown is hurting the economy and it cannot carry on, so on and so forth, my answer is, if you had put in your control measures as soon as possible, January, February 2020, you would have had a shorter lockdown, you would have had fewer people die, you would have had better control. So we were lackadaisical until April, May 2020, by which time infection was widespread, and thereafter we've always been playing catch up. So what would I do differently? I would do what the plans have always said we should do. Act early, act fast, act extensively. And that's all that was required.
Dr. Bharat Pankhania, thank you very much indeed for joining us. He's a senior clinical lecturer at the University of Exeter Medical School. Thank you for that.